Hi everyone, my name is Jacob. I'm a student physical therapist at Northern Arizona University, and today I'm going to provide a case application for the International Classification of Functioning, Disability, and Health, also known as the ICF model. So here's a picture of the model, which was approved for worldwide use by the World Health Organization, also known as the WHO, in 2001, and its purpose is to provide a generalized and unique capability to organize and classify individuals based on their health conditions, body function structures, activity, participation, and contextual factors. So as the biopsychosocial model of health at the forefront of its creation, and a little bit about each section here. So health conditions are going to encompass things such as hypertension, diabetes. It's going to be the actual diagnoses that individuals may or may not have. Body functions and structures are going to be the physical functioning or the physical structure of an individual's body. So if someone is unable to move their elbow all the way into flexion, they would be impaired in elbow flexion, and that would fall under body functions and structures. Activities are going to be activities at the individual level that someone may participate in. So walking, being able to walk up or down the stairs, being able to perform your ADLs, your activities of daily livings, those would go in activity. And then participation would be activities that individuals take part in at a social level. So being able to go play in your rec league, being able to go to work, being able to go out and have your societal role. And then contextual factors would be all your personal environmental factors, your age, your gender, your habits, where you live, what kind of air you're breathing, and everything that might fall under there. So as a student physical therapist, I use this model to break down cases that are presented to me and be able to classify and tackle each characteristic of each case and have a framework to do so. So today we're going to go through the case of Margaret. Now her whole history and systems review is presented on the screen here. I'm not going to read through it all the way. If you'd like to, before we get into the details of it, go ahead and pause the video. But we're going to start with identifying the health condition that Margaret is presenting to us with. So right here in blue, you see that she sustained a trimalleolar left ankle fracture and a left wrist Colles fracture 3 weeks ago. And it's important to know that she also had surgery on both of those fractures, including the open reduction and internal fixation of both. Now the trimalleolar ankle fracture will look something like this on the screen here, and the wrist fracture will look something like this here. So it's likely that when she fell, she tried to catch herself with her arm, and that's where you see that fall in the outstretched hand there underneath the Colles fracture. So that's the health condition that she's presenting with, and you can see that underneath the health condition box at the top in blue there. And then next we'll go into body structures and functions and the impairments she has with those. So in this short summary of the case here, the only body function structure impairments that are presented to us are her wrist and ankle pain. There are many more impairments at the body structure and function level in Margaret's case, which is not presented to us here. So what those are going to include, so we have her pain in her wrist and her ankle, but we're inferring that there's limited wrist and ankle range of motion because of the fact that she's had surgery on them. She's been healing them for 3 weeks, and she has not been partaking in any active exercise in those structures, so there's going to be some limitation in range of motion. And for the same reason, we are inferring that her wrist and ankle are also impaired with her strength. We can't test that on the initial exam, but it's inferable. And then another impairment that you could put in body structure and function is her balance, because she did suffer this injury from a fall at her house. So in your subjective exam, you're going to want to dive deeper into what was happening before she fell, what happened during the fall, figuring out if this was a loss of balance that might be presenting itself again later on, or if this was a freak accident that isn't going to happen again. So Next, we have her activities, her ability, and her limitations with those activities. So I'll go into a little bit more of the detail behind these on this next slide. So she's able to bathe and dress. The surgeon's orders are that she can take her splint off, and she can shower, she can dress. So that's an activity ability. She's able to exercise, which was also in these surgeon's orders. She's able to partake in the therapy we're doing, but the activity of that therapy would be the actual exercise. And it also said that she's able to ambulate with her standard walker and platform attachment, meaning that she's able to get around her house. She's able to transfer, meaning get in and out of bed, get in and out, or get on and off of the toilet, get in and out of chairs, things like that. Now her limitations, so she stated that she has increased pain when she tries to use her hand. So one of her activity limitations would be the functional use of her hand. She also said that the pain disturbs her sleep, so sleep would also be an activity limitation. And then she's also not able to bear any weight through her ankle or wrist. Now that is because of surgeon's orders, but that would still be an activity limitation no matter what is limiting that. And then in orange at the bottom there, we have her participation restrictions highlighted. So going further into that, her restrictions, she's not able to drive. She hasn't driven since the injury. Now, whether or not this is because of her medication cycle or because of her health conditions, that is to be determined. But either way, she's not able to drive right now. She has not been able to spend time with her grandchildren, as she is not able to get up and down from the floor. She's not able to be in the kitchen cooking for them. She's not able to take care of them as she once was. And then she's no longer able to volunteer, and she stated that her volunteer opportunities included a lot of walking, a lot of getting up and down, a lot of things she's unable to do right now. And then her ability, like I mentioned in her activity, she's able to partake in exercise. So her social role with that exercise would be coming to therapy. Although it's not maybe the best part of someone's social life, therapy is still a social interaction and is something she is able to partake in. And then in green, we have all of her personal and environmental factors highlighted here. I'm going to go into further detail with them on the next slide. So to start with her personal factors, the positives, she lives with her husband and she has strong family support. Living with her husband means that she has someone in the house with her who is able to help her if she needs it while she's healing. She has the strong family support, which means she's going to be uplifted and she's going to have that extra motivation, which is also listed there because she specifically stated that she is very motivated to return to her full health and get back to doing the things she loves to do. She's covered by insurance, which is a positive factor because she's not going to be in as much of a financial burden with therapy, and she's going to be more willing to partake in therapy because of that coverage. And again, she values the community involvement and family care, which means she's very motivated to return to her values and get back in the community and get back to, again, the things she loves. And then before her injury, she was active. It said she walked about 7,000 steps a day and was constantly doing things, whether it was taking care of her grandchildren or volunteering, but being active is always going to be a positive personal factor. On the negative side here, I didn't like putting some of these on negative, but there's no kind of intermediate portion on here. So 67-year-old female, it's just important to know that the older we get, the slower the healing process is going to be. And then it's known that females have a higher risk of developing osteoporosis. So if, back to the body structure functions, if balance is impaired, it's going to be important to really work on that to make sure we are safe from future fractures. And then her anxiety to return to participation may be a negative, as she may become physically able to return to her participation restrictions, but her mind might still be blocking her and she might be anxious about partaking in those activities for the first time again. So something to keep in mind as well. And then her medication cycle, again, it's not bad. It's not a negative that she's on medication for her pain right now. She just went through surgeries. She has 2 fractures. It's expected. But it's just something to keep in mind, making sure that we are able to eventually wean off the medication and not have to rely on it from there. And then environmentally, the negative would be that she lives in a rural community and has difficulty accessing healthcare. However, positive side of that would be that she was referred by her hand and ankle surgeons, which means she was able to access healthcare for her surgeries, and she's obviously in the clinic seeing us today. So there's a negative to it, but she was able to overcome that negative. And then here's my resource, the World Health Organization for the ICF model. Thank you guys for listening. I appreciate it. And yeah.